The government have reneged on a fair, affordable and sustainable deal. They have betrayed our trust. RB, we need to draw the line in the sand. Enough is enough. I urge you to support this motion.
I did medicine as a graduate, so have a sizable amount of debt in which sort of hangs around my neck, so I need to be in a position in order to repay that. Now, I'm not looking for sympathy, but my financial situation is such that I need to be able to make sure that I can repay that debt in a manageable way.
My career involves providing care to critically ill and injured children, a career that I love. But when I embarked upon that career and progressed through medical school, through my junior doctor years and into my consultant post, I did so with a contractual promise from the NHS and from the government about what the future would hold. This promise is broken in an unfair, unjust and unacceptable way.
Andrew Lansley, greedy Andrew Lansley isn't content to milk the cash cow. He thinks he can slaughter it and carry on milking, but it just doesn't work that way. He wants doctors to pay more, work longer, get less. This is not fair, it's not necessary, and we're not going to take it.
It was a very strong debate we had this morning, strong views expressed, and a clear expression at the end, I think, of where people want us to go next.
It's important for the council to test that mood at the moment, isn't it?
I think it's useful for council, when hopefully the government will come back to negotiate with us, and I think it's useful then to be able to have that strength of feeling behind us.
There was some discussion about if industrial action goes ahead again, what sort of industrial action that should be. Can you tell us about that?
Yes, I think people have considered how the 21st went and what they'd like to see happen in the future. And generally, people felt things went fairly well, but if we're repeating it, there would be a way we could perhaps simplify things to make it clearer. Patient safety would still be paramount, and we'd still ensure that emergency cover was provided, but we could perhaps clarify the action a little bit more.
And there's also been a motion of no confidence in the Health Secretary, a call for him to resign this morning. The strength of feeling continues to rise, doesn't it? Can you sum up for people why that's important?
I think taking that motion as well, it was really people felt as a whole there's an issue with how the NHS is being managed, and they just feel that they're not being listened to and their views aren't being properly taken on board in things.
And yet there continues to be a concern about the doctor-patient relationship and whether the public truly understands why you are complaining about this when the sums of money discussed obviously are so much more than the general public get.
Yeah, I think that it has been a difficult part of the media message given some of the sums, but I think the key messages we keep coming back to is this lack of fairness. Fairness with others in the public sector, and also going back on a deal that we'd already agreed 4 years ago. And I think those messages do still resonate with the general public.
You must be pleased to see the reaction amongst junior members.
Yes, it's good. A big part of our work over the past year or so really has been trying to engage with medical students and juniors, and I think they are now realising, I think particularly when you see the sums involved, talking about one of them saying it's a house effectively that the government's taking from you. I think that starts to then ring true, and obviously medical students now come out with so much more debt than before. I think they really are getting more interested in the topic.
And what are your feelings as part of the pension committee now about how this should proceed?
Well, as we've said before, ideally we get meaningful negotiations. What we've had up till now have not been meaningful negotiations. They've been discussions within a very strict remit, and I think we need to look at things properly, recognise all the changes we made back in 2008 and take that into account when looking at how we move forward. We've not been unreasonable in the past, we're not being unreasonable now, we're just wanting a fair deal. That's
not very likely though, is it, given the current financial difficulties?
I think the key point we make though is that our pension scheme, the NHS pension scheme, isn't in financial difficulty. It's clearly in surplus, there's a cost sharing agreement in place, so actually the finances shouldn't really be coming into it. And it's not for the NHS staff to bail out the financial mess caused by the banks.
Are other NHS staff going to suffer if doctors' pensions remain at the level that they have been?
Well, of course, it's not just doctors' pensions, it is NHS pensions. And we are all in the same scheme. So there's been a lot of support from other unions for the action that we've been taking, because it's their pension too.
So what happens now? Because technically the members have voted that they want to go ahead with more industrial action, but that decision is not made by the members, is it?
No, it's UK Council that have the ultimate responsibility to take that decision. And obviously we did the ballot, we got a very strong response to that. We are legally entitled to take further action. but council has to decide on the best course with regards to timing and nature of action, with regard to any movement from government. And obviously, as we've always said, our doors open to meaningful discussions.
And how soon are we likely to hear whether that is going to be the case?
Well, there is a further meeting of council this afternoon. Hamish Meldrum's finished his term of office and standing down, so there'll be a new council chairman, and there'll certainly be some discussions at that meeting. There's also going to be a further meeting in a few weeks' time that's already timetabled in as well. So, between those two, in the next few weeks, we'll certainly have a clear plan where we're going next.